completely clear, settling into complacency right now would be catastrophic. Right now is precisely the worst time to let our guard down, because we may be close to the maximum of cases, and we're either going to go back up and go to where we know we shouldn't, or we're going to be able to make it through to the other side and recover and show how it's done, how a community makes it through this. If we start going out, we'll reverse the progress we've made so far, and we'll be right where we were back 3 weeks ago. We'd set on a path of prolonged, unnecessary misery and economic hardship beyond what we've had so far. I've also said that before we can open up, we need universal, quick testing. The good news is that we're getting reports. I was just getting reports this morning. Our county sites are getting results back within 48 hours. Walgreens sites, of course, that we announced yesterday, those come back within 24 hours, and hospitals have fast turnaround times as well. So what we're doing is working to ensure that when we do open back up, that we'll be able to pair folks with symptoms to the test. And one area, for example, where we're at more risk of spread is of course, places where people are in close contact, places like nursing homes or homeless shelters. And one obstacle we're trying to go beyond right now is we have a requirement from FEMA that our materials have to stay in the test site. We can't take them to those facilities. So we're working round the clock to try and get that corrected, and we need to be able to do that in order to lift the order to move on, is to ensure that no person with symptom goes untested, because we have to be able to identify the folks who have the virus and isolate those folks and their contacts so the rest of us can go back to work. I've said all along that as we expand testing, we need to do it in a smart way, and that's what we're doing. Another issue is geographic access. You know, generally we were having issues because we had sites in two ends of the county. Now we have our mobile sites, so we're getting there little by little. Today I want to announce that in order to reach our goal of ubiquitous, fast, affordable testing, we will begin opening our county sites to anyone who has reason to believe they are infected, even if they're not displaying symptoms. Now, that does not mean you go if you're just curious whether or not you have the virus. It's not for folks who've gotten sick and recovered. This is for folks concerned about an active infection. We'll be prioritizing, as always, people with symptoms. We'll then prioritize, for those without symptoms, we'll prioritize first responders, including law enforcement, of course. To get tested, folks should visit the screening tool on readyharris.org, and on that site we also have the resources for all the other free and government-sponsored testing throughout the region for the neighboring counties. After we do this, we might find that eventually we have saturated the need for testing, and that's where we need to be. But right now, we have enough evidence that we just need to be able to match folks with the tests they need. One day, we'll have enough to test everybody with symptoms. That's what we're working toward. And as the cases continue to slow down, we will be able to get there. Things are looking up. The sooner our economy is up and running, the better off we are. But we have to be smart about it. Just like you can't toggle a switch on and off, Harris County can't suddenly come back online with a flip of a switch. We have to be gradual, we have to be thoughtful in the way in which we reopen. And so as discussions are happening about what it would look like to reopen, we have to make sure that A, we're where we need to be, but also I want to give an idea of a little bit what folks can expect. Folks should expect to see precautions everywhere: masks, gloves, other important measures like social distancing. But the first step is to reach that peak. Second step is affordable and universal testing, which we're also working on. And we're not necessarily there yet on either of these, but we hope to be there soon. I share everyone's urgency to get back to normalcy. I share everyone's urgency to get the economy back and running. I know the sacrifices that we're all making. That's why the county committed $10 million for small businesses and why we're looking at doing more. But we all need to continue working together toward the common goal of moving beyond this. And right now, I still need to ask that we dig in, that we stay home until we know we've reached that peak and until we know it's safe to move on. Otherwise, we'll undo the progress we've already made. And in order to do justice to the sacrifices each of us has made and everyone in our community has made, we have to see this through to when it's safe to lift. So the bottom line is we need more data. Every day we get more of it. We need a few more days to see which way the curve is actually headed. We can't flip a coin and risk thousands of lives. We can't choose an arbitrary date to open up. We have to be guided by the information, as we always have been. This is not a gut decision. It's not an emotional decision. This is time for data-driven, science-driven decisions, and that's what we'll be doing. I'll repeat my remarks in Spanish, then we will take any questions folks have. Dr. Umair Shah is here as well from our Public Health Department, and so he's also available to answer questions. En español, primero me gustaría anunciar la nueva información del día de hoy en cuanto al número de casos. Hoy tenemos en el condado Harris, fuera de la ciudad de Houston, 40 casos nuevos, 2 muertes adicionales, encima de las muertes que ha reportado la ciudad de Houston el día de hoy. En total hay 4.460 casos registrados en la ciudad y el condado y 67 muertes. Eso nos recuerda lo que estamos batallando, las vidas que estamos perdiendo, la lucha en la cual estamos. Hay buenas noticias. Parece y hay señales que la curva se está empezando a aplanar, que la tasa con la cual están subiendo el número de casos cada día es menor la velocidad con la cual esos casos crecen. Entonces, esas son buenas noticias. Nos está yendo mejor que todas las demás grandes ciudades en los Estados Unidos. Y eso es gracias a los sacrificios de todos ustedes. El día de hoy precisamente estuve hablando con ciertas personas residentes del condado que llamé a ver cómo estaban, qué tenían en mente, y todos ellos me dijeron que es mucho el sacrificio, me contaron acerca de sus familias, del miedo que tenían algunas personas mayores preocupadas de contraer el virus, pero cada persona me dijo también lo agradecidas que estaban por los sacrificios que todos están haciendo y explicando ellos también los sacrificios que han tenido que hacer quedándose en casa, no viendo a sus amigos, pero necesitamos seguir trabajando porque así hemos llegado hasta aquí. Sí quiero reiterar que todavía no hemos llegado al pico de la curva. No hemos pasado todavía el momento más difícil. Puede ser que se esté aplanando la curva y luego vaya de subida. O puede ser que se esté aplanando y ahí sí empiece a bajar. En este momento no sabemos que hemos llegado a ese pico, porque todavía no ha empezado a bajar la curva. Tenemos que primero ver una información consistente que demuestre que el número de casos nuevos va hacia abajo, y todo esto es en cuanto a admisiones a los hospitales. Como siempre estoy en contacto con doctores, expertos de salud pública, acá está también el doctor Shah para responder preguntas, y ellos nos dicen lo mismo. Han explicado muy claramente los doctores del centro médico que viendo la información de sus hospitales sí se ve aplanada la curva, pero no se ve todavía que haya pasado el pico. El no seguir con las precauciones en este momento sería catastrófico. El día de hoy, estos días, es precisamente el peor momento para darnos por vencidos, para decir, ¿sabe qué? Ya me aburrí. Porque sería muchos pasos atrás. Finalmente, desharía todo el trabajo, sería deshacer todo el progreso que hemos hecho, todos los sacrificios que tanto usted como sus vecinos, su familia ha hecho, y para respetar los sacrificios que hemos hecho todos, tenemos que seguir con esto hasta que sea responsable empezar a salir. Todavía no lo es, por lo que no sabemos si hemos llegado ya a ese pico. También he hablado mucho acerca de la necesidad de pruebas universales, a nivel universal, pruebas que todos puedan acceder a bajo costo, sin costo. Las buenas noticias es que hemos recibido reportes que nuestras sedes del condado, los centros de pruebas, ya están recibiendo resultados dentro de 48 horas. Eso es bastante rápido. Como saben, los 2 centros de Walgreens que anunciamos ayer, esos reciben los resultados a las 24 horas y las pruebas en los hospitales también son rápidas. Entonces, cada día que pasa va esto mejor y mejor. El reto que estamos teniendo es que obviamente tenemos que priorizar las áreas donde esté la gente en contacto muy cercano. Centros para personas mayores, para personas sin hogar, etc. El reto es que FEMA, la agencia federal, requiere que los materiales en los centros de pruebas permanezcan en los centros de pruebas. Entonces no podemos ni llevar los materiales a esos sitios, ni tampoco traer a los pacientes porque sería exponerlos también a más riesgo. Entonces estamos en conversaciones con FEMA todos los días hasta la noche intentando aclarar esa situación. Hay retos geográficos, tenemos sedes en ciertos sitios, otras que estamos moviendo, pero ahí hay más demanda. Entonces estamos intentando ver cómo nos permiten mover esos recursos para asegurarnos que toda persona con síntomas esté recibiendo las pruebas. Siempre he dicho que tenemos que expandir las pruebas de una manera inteligente y el día de hoy lo haremos así. Me gustaría anunciar que para llegar a nuestra meta de pruebas universales vamos a empezar a abrir nuestros centros de pruebas del condado, ya hay 6, a cualquier persona que crea pueda tener el virus, aunque no tengan síntomas. Eso no significa que vaya a la sede, que vaya a la página web, si simplemente tiene curiosidad y le gustaría ver solo porque sí. Esto no es para personas que ya se han enfermado, ya se han recuperado, es para personas que puedan tener el virus en este momento. Entonces, si ha estado en contacto con una persona que tenga el virus, si cree que usted tiene el virus, puede visitar readyharris.org y empezar el proceso para registrarse para una prueba. Hay ya 6 sedes a lo largo del condado y estamos trabajando por hacer todo aún más accesible. También en Ready Harris está la lista de centros de pruebas regionales de los condados alrededor nuestro y de la ciudad también para que pueda tener ese acceso. Sé que hay conversaciones acerca de reabrir la economía y entre más pronto regrese la economía, eso sería lo mejor para todos, es lo que yo más quiero. Pero no podemos simplemente prender las luces en el condado Harris así de un día para otro. Va a ser un proceso paulatino, con mucho cuidado, informado por lo que nos están diciendo los expertos. Y estamos trabajando en ver cuándo será el momento para hacer eso. Todavía no lo es, porque como he dicho, no hemos llegado todavía al pico. Ahorita es el momento de terminar esos esfuerzos que venimos haciendo. Sí quiero explicar que cuando llegue el momento de reabrir, hay de esperar que vamos a tener que tomar precauciones que ya nos estamos acostumbrando a tomar. Por ejemplo, utilizar las máscaras cuando estemos con más gente, también mantener esa distancia de 6 pies, tal vez guantes, otro tipo de medidas que vamos a tener que tomar en nuestra vida básica. Pero nuevamente para poder abrir necesitamos llegar al pico, necesitamos poder darle pruebas a cualquier persona con síntomas para poder aislar a esa persona. Siento el impacto en nuestros negocios, en nuestras familias. Es por eso que el condado Harris ha otorgado $10 millones a pequeñas empresas. Es por eso que estamos viendo una segunda ronda de este apoyo y seguimos viendo qué más podemos hacer. Pero la conclusión y fundamentalmente en este momento necesitamos más información. Necesitamos que más días pasen para ver hacia dónde va la curva. Esto no es algo que podemos tirar una moneda, ver dónde cae y decidir. No podemos elegir una fecha solo porque sí, decir, bueno, 1 de mayo y ya. Tenemos que ver lo que nos dicen los líderes de los hospitales, lo que nos dicen las proyecciones y hoy día lo que dicen es falta un poquito más. Entonces, por favor, sigamos con esto para que no perdamos todo el esfuerzo y los sacrificios que ya hemos hecho. Y vamos a salir adelante juntos. Con eso concluyo. Vamos a recibir preguntas y también está aquí el Dr. Shah, el director de nuestro Departamento de Salud, para contestar cualquier pregunta. We'll take questions now. And Dr. Shah is here as well to answer questions.
Thank you so much for making time. I'll be asking questions on behalf of all of the news stations. First with KPRC, the governor has moved to start the economy going by opening up parks and retail for pickup. Will the county follow suit, and to what degree?
Yeah, you know, the governor and I share an urgency to open up the economy. We've been in close communication about how we would do that. We've worked closely together on the efforts at Walgreens, for example, yesterday that we were able to unveil 2 sites. This whole thing is about data and information. As I said, we are still analyzing what his order will mean for Harris County. We're trying to sort out, he's issued several orders, so we're trying to assess what that is. What I do know right now is we've not hit that peak, and so we can't responsibly open up. But look, it may be that by the time his orders come into effect next Friday, I think it is, or next Wednesday, that we're there. It will depend on to what extent folks continue to stay home this weekend. If we don't, we'll go back up and we won't be able to do any of this. So that's where we are.
And I heard in the, the news conference in which you just announced that you are really looking at data-driven actions taken by data. What data are you specifically looking at when it comes to opening up things like the parks and retail? Specifically in regards to boosting the local economy, what data would you be monitoring?
The most important piece of information is the admissions to hospitals. That's always been our guiding light. And then, we're working on different models. We've been watching the models that are out there. We're trying to build our own. We're still tweaking it. But really what we're going off of is the hospital admissions, because we know that the testing, the case count may grow just by virtue of the fact we have more testing. And so the good news is that we have that information from the hospitals, that the information shows that the curve is flattening. The difficult news is that doesn't yet show that the rate of admissions, be it to just general population or the ICU, it looks flat. It doesn't look like it's dipping down yet. It might be. We need to give it a few more days. Or if folks don't do their part, it might start climbing back up again, and then we're back at square zero. And so that's really what we're focused on. And once we start going down, then we can open, and it'll be a phased approach. But it's not a matter of, okay, what do you open now? And, as I said before, that's really the easy part. The peak will hit not because we've developed herd immunity. It will hit because we've been keeping distance from one another. And so the minute you start having close contacts again, regardless if that's in the park, if that's at a restaurant, if that's at retail businesses, whatever it is, inevitably the case count will go back up again. And so we can't have it go up when it hasn't started coming down. And we can't have it go up when we are not able to test and isolate everyone with symptoms. So we're working on that all at the same time. The timing may just line up, but that all depends on people continuing to stay home. We are very much not there yet.
Last week, the city and officials in the county had indicated that Houston could be a potential hotspot, and that that the governor needed to look at allocating resources for our area. Is that still the case this week, as it sounds that you're saying we're doing better than every other city in America?
We are. Look, you look at a map and you see the size. There's usually a circle. It's usually red. Whose size is represents the size of the outbreak. And every big city has a big circle around it, but our county, our region does not. And that's because of what each of you have been doing. Now, could we still go into a crisis? We could, if people go out before we're supposed to. Again, the curve is flattening. That is great. That is because of deep sacrifices we've made. That hasn't happened by accident. That happened because we made the decisions early on and because folks took personal responsibility to do their part. But we still need them to take personal responsibility because as it's flat, it's not yet coming down. We may yet go back up. So help us out. Let's finish this off. Let's keep that distance. Let the case count actually fall, the intake actually fall, and then we can move on.
Another question from another reporter. What is the status of the system glitch that allegedly resulted in hundreds of inaccuracies with county employee paychecks, many of whom were first responders?
I know that we had an issue with some folks receiving more pay, and that's been worked out. You know, the assessment was nobody had such a huge amount, such a huge addition, then having to make it up at the next pay period would be, too impactful. We followed up on that, and my understanding is it's been taken care of. If there's something else, we'd have to follow up. That's the latest information I have.
Question for KHOU. Last week you referred to this as this generation's Pearl Harbor moment. Were you referring to the virus? Do you still think this?
Yes, in many ways, we were not taken by surprise in Harris County because we were watching what was happening elsewhere. We were preparing, and folks listened and did their part, and we're not done. We need folks to do that and continue doing their part. But the country was taken by surprise, much in the way of that. This is a virus, this is a war we fought globally. It is a war that has led to thousands of deaths across the country, that has led to dozens of lost lives in our community. Now, we have been able to improve, we have been able to do better than other places, and that's because when you see something coming, you respond accordingly. People are doing that, but we're not done. We're still, in my mind, in the middle of a battle. The battle is in our shores. It's come to us. What's unique about this is we have the power to control the force with which the enemy comes. And so if we let our guard down, it'll come back and it'll take over.
Another question from KHOU. It seems that no mayors or county judges are part of the governor's advisory panels to have Texas back in business. Was the judge invited? Were you invited to any of these groups? If not, do you think that cities and counties should be represented in these panels by officials?
I've had great conversations with the governor about the topic of opening up. The discussion has always been, we're very much on the same page that we have to do it in a way that is responsible, and we need to have enough testing, and we need to make sure that our case count is coming down. And so we'll be watching that. I expect that we'll continue to stay in close contact. I'm certainly in touch with the other mayors and county judges. I honestly haven't seen the composition of the panels, so I can't say, that it's adequate or not, but I have had those conversations with the governor and plan to continue having them.
Okay. Another question from KHU. While we are talking about reopening businesses, the county just finished building a multi-million-dollar makeshift hospital outside NRG. Does this send a mixed signal, or is this for some type of resurgence?
We just finished our shelter about a week ago, and look, right now, it's not time to say whether we overdid it or underdid it. And I am willing to take a hit on we did too much. That's fine with me. And if it turns out that our peak was never above our hospital capacity, and so we built this medical shelter and we didn't use it, well, folks will say, why did we go forward with it? And that would mean that we succeeded. But we have to be prepared for the worst. We can't underprepare, especially when we see something coming. I refuse to put our county in the position New York has been in. Speeding up the construction of a medical shelter in the middle of a park while people are dying, that's not a position befitting of this community. We can do better than that, and we built this to prevent that from happening. We may yet get there. I hope not. I think the way folks have reacted, staying home, what the curve shows, every day it's less likely that we'll need it, and that's great. If folks begin to go outside and have contacts before we're supposed to, we may still need it. And of course, remember, we have an agreement with the federal government that they'll reimburse 75% of the costs of the hospital, of the medical shelter. We also know that it's phased. We only approved funds for it to be there right now with the doctors we would need if folks were to come in, but we've not expanded, we've not committed to more than a certain time period. So this is all about being responsible, being proactive, and not just waiting for disaster to strike and kill thousands of people before you act.
With that being said, how are our hospitals doing? What is the status of PPE and supplies that medical professionals need?
Better. The way you look at the hospitals is not so much how many beds are open at any given point in time. You know, having a snapshot is not necessarily helpful. It's how quickly are those beds being taken up. And so when we instituted the Stay Home, Work Safe order, when we extended it, we were here with representatives from the Texas Medical Center, and they were talking about how that case count, that intake rate was going up exponentially at first, linearly later. That was too dangerous because quickly they could find themselves overwhelmed. Today, if you look at those curves, and we'll make sure the data is linked out of Reddy Harris, it's all been available through CETRAC, through our regional partners, is you're seeing a flattening of that. That's the curve that's flattening. So in that sense, they're doing well. Now, it's a cautious optimism because that depends entirely on what people do. The only reason we've gotten there is because folks have done their part in staying home. In terms of PPE, we continue to produce it. We have been working with Houston Community College. We've been working with other organizations, institutions of higher learning to help us produce more masks. We're receiving more PPE and masks by the day. The county was able to procure materials on its own for the 2 sites we announced earlier this week. And so really all of this is getting better at the same time. And what folks have done is they've allowed our community time, our national supply chains to catch up so that all of this hopefully comes together in the right moment. And so we just have to stick to it for a little bit longer, wait for that peak to really happen, wait for the testing to get finally figured out, and let us be thoughtful about this so that we can put it behind us little by little. Now, I do want to remind folks, we talk about one peak, but inevitably there's going to be more. You know, this is going to continue. We don't have a cure. We don't have a vaccine. So our lives will change. We will have to get used to wearing masks and get used to staying apart from one another, and we'll have to take measures. And look, it may be that despite our best efforts, there's a resurgence, and we have to be prepared for that. So this isn't something that's going to just be over with, we open back out, we're all good. But what we're doing is putting our community in the best position possible.
Question from Univision, if you could answer both in English and Spanish. Do you believe that the plan will have residents eventually be required to have face masks, to wear face masks and coverings?
Yeah, a question about whether folks should wear face masks. It is something we're looking at. We watched very closely the implementation of wearing face masks in Austin, and the issue was it came overnight, and so there was a lot of rush to purchase those. There was some animosity, you know, where people were able to get them, and so we want to make sure that if we institute something like that, that we give enough lead time and ability for folks to be able to obtain the masks. So these are conversations I'm having with Mayor Turner as we speak. I do think that at some point, and certainly as we open back up, we're going to need to do things like wear masks, like stay away from one another, because that way you minimize the spread. We're going to have spread. We're going to have resurgence. But if we take those precautions, we have enough testing, we have enough epidemiologists, and we're working with Dr. Shaw on that and with the city, that we'll be able to tackle cases in discrete groups, and we'll be able to just isolate that group, and the rest of us can go on with our lives. En español, la pregunta se trataba de coberturas, y sí estamos explorando el requerir que las personas utilicen esas máscaras protectivas. Lo que hemos visto en Austin es que requirieron las máscaras de un día para otro. Entonces las personas tuvieron que ver a ver cómo encontraban sus máscaras. Hubo un poco de fricción, problemas ahí porque no estaban disponibles. Entonces queremos darle suficiente tiempo a todos, asegurarnos que hay suficientes máscaras disponibles. Estoy en conversaciones con el alcalde acerca de eso, pero sí espero que especialmente cuando volvamos a abrir, que vayamos a requerir máscaras, distanciamiento social y más medidas. Eso nos permitirá minimizar el contagio y al mismo tiempo trabajando con suficientes pruebas, con los epidemiólogos del Dr. Shah, de la ciudad, también podremos asegurarnos que en cuanto haya más casos o nuevos casos, poder aislar tanto el caso como sus contactos y que los demás podamos seguir trabajando.
Just to be clear, do you see that requirement coming anytime soon?
I'm still in conversations with the mayor. It's certainly possible that it would come soon before we open up, but I don't want to get ahead of the conversations that we're having.
Last couple questions for you, Judge. Thank you for your time. What do you have to say to those business owners who are watching, who are very concerned about the future of their business because of, the moving target on when we can actually open things?
Yeah. I hear you, to all the business owners, to everyone who's lost a job, to everyone who took a chance on a new business only to see it falter right now because of the economic situation. I understand your pain. I know it. I've seen it with people that I know. I've seen that impact. And as much as you do, I want our economy to get back on track. The decisions we're making are so that our economy can come back as strong as possible. If we lift the restrictions too soon, the only thing that's going to happen is we're going to end up back where we were at the very beginning, and we're going to have to wait another 4 weeks to flatten the curve and eventually peak and eventually try again or longer. Right now is the time to finish what we started. That's social distancing. That's gotten us to where we are. That's ensured we're doing better than many people thought. We can't just pat our backs and say we're done. We can't give ourselves arbitrary deadlines. This isn't a coin toss. This isn't a, hey, I feel like it's the right time, let's do it. We are looking at the information as that curve truly begins to peak and as our testing is truly up to par. Rest assured, as soon as it's safe to open, we will do so, not because we want it to take longer, but because we want to make sure that when we open, that we're putting ourselves in the best position not to have to rebound and be right back where we started.
Thank you so much. Dr. Shah, I have a couple questions for you, if you don't mind.
Yeah, and I do want to reiterate for our business owners that the county has made available that $10 million. I don't want to pretend like that solves the economy, but we are looking with Commissioner's Court, I know commissioners are having these discussions at the staff level in terms of what would a second package look like to continue to solve or support. Certainly we can't solve these challenges, but we can do everything possible from the perspective of county government, and we will continue to do that. You had a question for Dr. Shah?
Yes. Dr. Shah, from your perspective, how is the county doing with its hospitals right now? Is this, flattening of the curve a direct product of actions, social actions for social distancing?
So Dr. Umair Shah, the Executive Director of Harris County Public Health and Health Authority for Harris County. And thank you for that question. Thank you, Judge, for everything you've said and really our county leadership. I really want to just give gratitude for the amazing support that we've received in our health activities. I think your point is a really good one. What the judge has outlined is exactly what we're seeing. I actually had a chance to visit one of our hospitals a few days ago, and it was quiet at the hospital, and that was, from a COVID-19 standpoint, very good news. What we are saying is that what we have done, and this is not just about county, city, region, government, this is about a community. What our community has done together has really helped us get this staying ahead of the curve and flattening the curve and doing everything that we can. That has worked because all of us have worked together. When we reopen, and we will reopen, when we reopen, we have to make sure that we continue to stay distance from each other, because that message has to be clear that our lives have changed Just this evening, it's my wife's birthday. We're going to be doing a virtual birthday. Happy birthday. I want to say that is something that my daughter, who's 10 years old, now for the rest of her life, she's going to be thinking about that birthday that she had for Mom. We are transformed in ways that we never thought we could be. But it is too early for us to be able to take our foot off the pedal. We have to make sure we sustain, and as the judge mentioned, the evidence and the data and the science, that helps us make good decisions. And that's what our community expects of us.
What is the latest that we know of the virus? Is it continuing to mutate? Has any of its characteristics changed? What do people need to know?
So this is one of the most, let me go back. It's actually likely the most studied virus of today in the world. Now that said, this is also the good and the bad of that. The good of that is that we're learning every day phenomenal amount of information about this virus. The bad of that is that as we're learning more information is changing. So we'll hear something one day before, the next day the evidence starts to shift or the science shifts, and we have additional information that perhaps gives some confusion to what we heard just the day before. So from a standpoint of mutation, we haven't necessarily seen that, but there are a couple of strains of this virus that also then are in the mix for how do we really, at the end of the day, fight the virus. There is no vaccine, unfortunately. There is no antiviral medication, unfortunately. There is no antibiotic. It's not even bacteria. There is no silver bullet for this virus. Our only hope and our only fight against this virus is what we can do together. We have to be emotionally together and physically apart. And that message, I think, is our only hope against this. So the last thing I would just say about that is that while we anticipate that some mutation or some genetic drift may happen, we're also hopeful that with coronaviruses in general, that you do sometimes see some seasonal variation. We're hopeful that happens here. But we also can't let our guard down, because in the fall or in the winter, we want to also make sure whatever is happening with this coronavirus right now with COVID-19, that it doesn't come back in a way that we're not prepared for.
Now, there's been mention of a resurgence, a possible resurgence. What does that mean for people and their actions that they take from here on out?
Well, again, as the judge mentioned, that when we open, when we get back to some level of normalcy, which is not going to be the same as we've had before, because all of us have transformed with this, I really think that we're going to start to see some of those same activities that we have already instituted. So whether it's how our kids are educated, whether it's how we go to work, or whether it's we don't shake hands and don't get as close to each other, whether we wear something on our faces to make sure we don't expose someone else. These are all different activities that we have now in our culture, and we're going to likely have to sustain it, and we're going to be living with that for time to come. Now, we're hopeful that we don't get there, that this is months and months and months and months. We hope that we get past this virus as quickly as possible so we can get back to as close to normalcy as we can.
And my last question, thank you so much for your time,
absolutely.
Doctor, is are you aware of inaccurate testing or false tests that are out there? And if so, what is the county doing to sort of fight against those inaccurate tests?
Sure. So we believe that testing is such a critical piece of this. The judge has mentioned this. The physicians, the healthcare community has mentioned this. Public health, we've mentioned this. So obviously, it's so important for us that we are concerned if there's ever a situation where the integrity of testing is questioned. And whether that's integrity of testing because something is about that specific test, or the persons or the entities who are running a test operation. So we're watching, we're certainly mindful of that, we're monitoring, we're working with our county attorney's office. If we do discover that there is concern for integrity of the testing anywhere in our community, I know the judge is committed to, we're going to stamp that out. That is not just that it's not allowed, it is absolutely counterproductive to the integrity of the absolute critical piece of what we're trying to achieve, which is to understand how much virus is in our community and how many people are infected. So absolutely that's on our minds. Now, that said, we have seen in other communities where there have been fraudulent activities happening, and we're certainly mindful of that here locally. Thank you
so much.
Judge.
Thank you.
You good? Yeah, thank you.
All right, appreciate it.
You've just heard from Harris County Judge Alina Hidalgo, who says the curve is flattening, but we are not at the peak yet. The county needs to see a downward slope consistently, she added. She also emphasized testing. Testing is open to people who are symptomatic or asymptomatic now, but you can be tested if you think you've been exposed to someone with COVID-19. That's the caveat there. That's it for this. Now let's get to your other headlines for this Friday. President Trump at any moment now to give us our daily briefing from the White House in regards to COVID-19 and the latest efforts and response. Just as soon as we see the president step to the podium, we'll be sure to take it live.
So today I'm issuing an executive order that outlines how we go about opening the Texas economy, helping you return to work using the safest standards to contain the coronavirus.
The big story at this hour, Governor Greg Abbott announcing a plan to reopen Texas businesses amid the coronavirus pandemic. The governor is establishing a strike force, which includes a team of state health officials that will begin the reopening process. The governor also announcing all Texas schools will remain closed for the rest of the academic school year and continue with online learning. We have complete team coverage for you on the governor's guidelines and how it will impact you. Let's start with Adam Bennett, who shows us what will open up first.
Well, Mia, the stay-home order has kept most of these businesses near the Galleria closed for the last few weeks. Now Governor Abbott is saying that the state is using data and doctors to gradually reopen. That newly formed strike